Hello. The materials on this DVD have been developed by WaMH, Wales Mental Health in Primary Care. Its purpose is to help primary care providers to deliver more effective services to patients with mental health problems. Dr Mark Boulter, a GP working in Llandovery, is Vice Chair of WaMH.
WaMH, Wales Mental Health in Primary Care, is a network of individuals across Wales who have been working to improve services in primary care for people with mental health related issues. We're developing at the moment a whole host of different materials and training for primary care staff looking at improving services. We're calling it gold standards, and part of this is we've developed this concept of 3 hallmarks which underpin what we feel are really good services for patients. And the 3 hallmarks are trust, communication, and working in a patient-centred or a person-centred way. Now, we hope that those 3 hallmarks actually shine through our training materials as well.
So, Mark, tell me about this training package.
We've developed this training package to support people in primary care to improve their knowledge, their understanding, their skills in the area of mental health, so they can start to think about the services they provide and understand how they could do it differently, so actually the experience of our patients can be improved. What we have to understand is there are quite real barriers to access to our services, which is for all our patients, but particularly people with mental health related problems.
What's the training all about?
The training is all about trying to improve access to our services for people with mental health problems. But I think it's very important to recognise that all of us as individuals, our staff, all have mental health needs as well. So this isn't just about people with mental health problems, it's about all our patients. And as part of doing this, we've actually tried to access the views of patients in Wales to see what their feelings are about our services.
Why did you choose this area of work?
This is a hugely important area of work. A recent high-profile study by the Disability Rights Commission before it was wound up, called Closing the Gap, showed that patients with mental health problems in Wales suffered very, very startling and worrying health inequalities. But some of the estimates were that people were dying 10 years younger just because they had a mental health problem. 10 years. That's 10 years of somebody's life. Now, some of these health inequalities almost certainly relate to the difficulties and the barriers to accessing effective healthcare services. But we do have to accept that people with mental health problems have all sorts of other issues in their lives.
So, do we have a picture of how common mental health problems actually are?
Mental health problems are extremely common, far commoner than we really think. Some of the estimates are 1 in 4, 25% of the population will experience a mental health problem at some point in their life. 1 in 4. That's actually 1 in 4 of us, as well as 1 in 4 of our patients. But this is a huge part of a problem which faces modern society and something we have to get to grips with. And these mental health problems can lead to things like long-term joblessness and other issues which affect the lives of our patients and can lead to huge complexity in our working lives.
Now, what's the legal situation in this area?
Well, it's very interesting because a lot of people don't recognise the fact that the Disability Discrimination Act actually applies to people with mental health related problems. We actually have to be acting within the law, and the law tells us that we have to be providing services which are flexible. We have to make adjustments, reasonable adjustments to the way we work to make sure people get an equal access to our services. That doesn't mean doing the same thing for everybody. It does mean actually being flexible enough that we can do more for some people so they can have the same range of services that our other patients actually experience.
So how did you go about getting the views of patients?
We thought it was very important for this training to actually find out from patients in Wales what their experiences were about primary care services. This is not about what's bad about primary care services, what's good and what is bad about services, so we can learn. They are the experts in this, not us. So we asked 2 organisations, Mind Cymru and HAFAL, who are national organisations within Wales, to run a series of focus groups to actually explore the views of patients in this area. And they ran these groups on our behalf there wasn't a doctor present. The patients themselves expressed the view that they felt very comfortable to express their opinions during these focus groups. And out of those focus groups, we developed a report which is actually the basis for this training video. So this training video is very much based on the real life experience of our patients, not just one or two, but a whole group of patients across the whole of Wales.
How important do you think patients' views actually are?
Well, I think they're vital, because the views of patients really, really inform us about what we're doing well and what we're doing badly. And perhaps in the past we've not been very good at understanding what our patients actually want. If you go to other industries, other organisations, they will tell you that understanding the needs of their clients, or whatever they call them, is actually fundamental to how they develop their services, and sometimes even complaints are the most valuable information they can gather. But listening to a whole group of patients, distilling that collective experience across Wales, helps us to understand what we're doing perhaps not quite so well, but also we can learn what we are doing well, and we can share that across our community in Wales so that we can continue to improve our services and make sure the patients get the service they really deserve.
How does this apply to all the people working in the surgery?
Well, this is a very interesting point. GPs and practice nurses often have had only a few weeks of experience of mental health issues, and sometimes many, many years ago in their basic training. And reception staff may have received no training at all. They just bring the skills, knowledge, the opinions from society to the workplace. And they do a fantastic job in a really, really stressful environment. But we think this sort of training package can help to support staff to actually develop on that, to actually understand the mental health issues more deeply, and to have a better understanding so they can improve their skills, knowledge and understanding.
So, what did patients say?
A lot of the patients expressed huge admiration and loyalty to their practices. They didn't want to complain, even when they identified issues which actually where they felt the practice had slipped up. They weren't in a mood where they wanted to make formal complaints about that, even though some of the issues actually sounded quite alarming. But no, people are generally extremely supportive of their GP practices.
What was it that they liked?
They liked the fact that everybody knows them, that when they come into the practice they're known, they're understood. They liked the fact that the GPs had known them for a long, long time. They had that sense of continuity of care. And for people with mental health related problems, continuity of care came out as a really, really important thread for them. That they really valued the fact that they were seeing the same person. That person understood their problems, not just their mental health related problems, but that all the problems they faced in their life, they understand them, their family, the circumstances. So people preferred to see the same professional if they possibly could.
What was it that they were concerned about?
Appointments was a huge area of concern for patients, and some patients expressed admiration for the way appointments work within their surgery. They were flexible, there were different ways of making appointments, they felt very comfortable making an appointment, and they thought that was really good. And we'll come to some of the issues that people picked up later where it generated barriers to access. But appointments was a huge area, and also the way the waiting room worked. A lot of people said their practices had a quiet area where they could sit if they were distressed, if they were crying, if the waiting room was very busy or noisy. It was an area where they could sit and feel comfortable. Other people say, there was a back way out, and if I've been in with the doctor for a long period of time, or if I've come out and I have been crying or I'm very distressed, sometimes being able to get out a back way is much nicer than having to walk back through a busy waiting room.
What kind of problems did patients report?
I'm a busy working GP, and I understand that actually running an effective appointment system is, in essence, probably impossible, because we have to balance access as well as continuity, and I think we're all struggling to try and get that balance right. But most of the issues came down to actually how the appointment system worked for patients. Some people found it very distressing if they were asked to give detailed explanations of why they wanted to see the doctor. Sometimes they had difficulty in explaining to the receptionist what it's about. They didn't want to. It was very personal. They found it very intrusive. So, again, many practices wouldn't be asking those sort of questions, but these questions are still being asked across Wales. Sometimes people found it very difficult if a friend, a relative, a carer phoned up to try and make an appointment. The practice said, that couldn't be done. It had to be the patient themselves who actually had to make the appointment. In other areas, there was issues about having to phone first thing in the morning, between 8:30, 9 o'clock to make an appointment. I know these sort of appointment systems are less common now, but they still exist in Wales. People with mental health related problems aren't good in the mornings.
Any problems at the